Signori e signori,
Ladies and gentlemen, dear healthcare professionals, welcome to this event titled Many Worlds, One Health. This is the first event in a series that we started on the 10th of May last year. We then continued on the 22nd of November, and today we are here. In our meeting in November, I had introduced the event with some words from Pope Francis' encyclical saying that without deep feelings, we cannot even start thinking. And this sentence, this statement is very deep to my heart. I've been studying here for 7 years, and in these rooms I've experienced this, and I feel truly moved by saying that in 1984, when I was a student here, we welcomed Mother Teresa, and I had a chance to ask her a question, and I asked her, do you have a statement, a sentence that it truly inspired you? And she said the sentence that Jesus said on the cross, I'm thirsty. And I believe that this answer that still gives me thrills is the real question that we are asked as healthcare professionals. Sometimes, concretely, sometimes the sick asks us, I'm thirsty. And sometimes it is asked as in a metaphorical way. So we are required to meet this need from people who are fragile, who are sick. However, the content of our path will now be summed up by Father Massimo Angelelli, the director of the Italian Bishops' Conference, Pastoral Care for Health. Thank you, good afternoon, and welcome back to this important hall. I would like to remind that choosing this university is very relevant because this place is in the Vatican territory. So we basically left Italy to come here, and this maybe gives us an idea of the width of today's proposal. You can see from the images that we proposed for this event that we wanted to share a global perspective. This is the third stage in our journey. And almost 2 years ago, when I met the presidents of the national federations, we asked ourselves, can we do something? Can we share some thoughts and insight around the Jubilee as we were preparing for this global event? So on that occasion, when we had a positive reply, we then asked ourselves once again, do we really need hope? And the answer once again was yes, of course. It was an easy answer because everyone needs a vision of hope. And we tried to reflect, to share some considerations on what kind of hope humanity needs right now. In particular, the world of healthcare needs hope. Because all of you devote your life to those who suffer, and those people need therapies, services, but they also need a new horizon filled with meaning. And I sometimes have a feeling that we are missing this in our country. The fact that we have an extraordinary national health system that works very hard. And here last November, as we discussed with other national healthcare systems throughout Europe, we experienced that we are doing very well, and we are happy for that. However, our patients also need an horizon for meaning and hope. And when we can find meaning in our suffering, we truly find that when we find a purpose for that. What I'm experiencing has a meaning for myself, for my vision of life, or for a person who's dear to my heart. And that it also has a meaning for believers, for their life coming after death. So this truly comes with a new horizon. And in among these considerations, we asked ourselves, who are those who are missing this kind of meaning? And we identified the concept of healthcare poverty as a concept which affects many worlds, many nations. In March 2024, we met to reflect on health poverties in Italy. In November 2024, in this room, we discussed health poverty in Europe, across Europe, and today we will broaden our perspective on the very meaning of health poverty from the standpoint, as many people say, that revolves around the concept of One Health. This is a great statement. I still have to grasp its very meaning, but I believe that that means that we have to act together, because the person that we have in front of us is unique. It is a person in any condition, in any social condition, in any part of the world, and in any age, at any age, and they need a unique answer by you from the healthcare world. So we need to act together for every and each person. However, throughout our journey, we also realize that you are also people. And of course, you are people, and I say that with the burden that this word bears, and you also need a perspective of hope, because your work is hard, is challenging, and we could say that it causes fatigue in your lives, and sometimes you are not allowed to work in appropriate conditions. It looks like that our systems are aimed at hindering us as professionals. So we have to find our internal resources to find a new motivation, new inspiration in our daily job. And this is another horizon of care. So people are not only the people that we assist, but also the people who are also the caregivers. So we focused on the care of caregivers, of healthcare professionals, and I'm saying that because I strongly believe this. And the recent approval of the Professional Ethics Code for Nurses has a specific article on the care of caregivers, of healthcare professionals. And I believe that this benefits the entire system. And the final and last horizon that we should feed is the system itself. I am sincerely sorry that sometimes we are used to complain about the system. It looks like nothing is working, but it's not like that. And I'm sorry that communication tends to highlight some objective things which are missing. However, that is not balanced with the good that you're doing. And this should be one of the elements that brings people to some kind of social anger that we are witnessing. So we should turn this trend, change this trend. We could say that it could be better, but it's not going that bad. So we need a new hope for our system. I've already said too much. I've taken too much time. So we will now listen to a series of high-level speeches, and we will gladly be listening to our speakers. And then we will also have some rituals, some gestures, some acts, like crossing the holy door at the end of this afternoon, which will be very meaningful. So thank you for being here. Thanks also to our participants online, and enjoy the rest of this event. Thank you, Father Massimo. We also thank the presidents of the federations and councils who really committed themselves for organizing this event. And we also thank them for the attention that they have devoted throughout these three events. especially their attention toward the spiritual dimension in its widest sense. It is something that belongs to everyone, and I was able to truly seize and get a sense of this need, which is not an additional component, but that is something which is embedded in the therapeutical process. So I truly thank the presidents of the national councils and federations. I will now leave the floor to Mr. Andrea Farinet, the president of the Pubblicità Progresso Foundation. Thank you for being here. Well, my role here is basically that of introducing Professor Farinet, a dear friend of mine. He's the president of the Pubblicità Progresso Foundation. He will share a reflection on today's subject, and he will also share the greetings of someone you all know, we all know, and I really like this person as an artist. So I thank Father Massimo, Don Massimo, for giving me the chance to introduce Mr. Andrea Farinet in this for this very short intervention. Thank you. Good afternoon, everyone. And I thank the organizers for inviting me. I came here to greet you and to thank you for your extraordinary work, for what you do on a daily basis. I come from a family who has had who's always had a deep connection with the healthcare environment. My mother worked in a children's hospital and for more than 30 years, so I'm very conversant with the world of healthcare. And what you do every day is truly extraordinary. So I really on my knees in front of your wisdom, on your dedication to your work. I have good news for you. The Pubblicità Progresso Foundation chose as the core topic for 2025 poverty. And unfortunately, I have to tell you as an expert in economics and sociology that our situation is unfortunately dramatic, because we are the second country in Europe for inequalities after Spain, and we measure that by measuring the wealth of the 1% of the richest families, and this gap has unfortunately widened over the last 10 years. So our society is increasingly unequal, and therefore we are becoming poorer and poorer. And we also become poorer because there's an economy which is unequal. One of my mentors at the Bocconi University was Carlo Masini. He was one of the greatest Christian economists in our country. And we are in this inequality because there's no respect toward people's incomes. And almost 50% of the Italian markets are markets where you call other people and you agree on having higher prices at the expenses of ordinary people. And if we take the real income of Italian people, of the Italians, compared to 2008, the real income compared to 2008 has decreased by 8.3%. In Sweden, over 20 years, income has increased by 60%. So it's really a shame there's no authoritative voice who speaks up. In Italy and in Europe, we have to find another social and economic model. This is damaging our environment, our societies, and our cultural and spiritual dimensions that we in Italy live and experience in a very natural way. So we should sit around the table and discuss that, because there's healthcare poverty, but there's also educational poverty. Many families are no longer able to invest in their children's education. There's food poverty. Now in Italy, 5 million families are in risk for their livelihoods, and there are hundreds of thousands of people who do not have a housing. So we are an extraordinary people for a culture. We release almost 7 billion in philanthropy, in charity. However, a few people all cannot compensate for an unequal system. So we have to reconsider, to change the paradigm of our system. We have to move towards a more human economy, which is more inclusive. I love Rome. I have many family members in Rome. I've lived here. My grandfather was called Francis, my father Paolo Francesco, and every time I listen to my father, to the Holy Father, I think he's the last independent, radical, strong voice who says, how are we going, where are we going with this capitalism? When after destroying the environment, and we are the environment where we live, where are we going after that? Well, we have a lot to do, to work on. We are working on these topics. We will be discussing the various forms of poverty, and I came here to learn from you about healthcare poverty. And I discuss these topics with a dear friend of mine who's named Andrea Bocelli. Sometimes we discuss these topics, and I asked Andrea, I told him that I was coming to this event, and I asked him to share his greetings. And he apologizes for not being here in person. He's currently in Asia for a series of concerts. They are now coming back from Taipei to Italy. But when I asked him, so he sent me a text, a message that I'm now about to read. Dear participants, I feel privileged to extend my greetings to you and to the sick. I truly hug them, and I want to express my deepest gratitude toward the Italian Bishops' Conference, the speakers, and all the people who contributed to today's event in the blessed occasion of the Jubilee of the Sick and the world of healthcare. The topic of your meeting is very dear to my heart. Even though this is connected to the imbalance between the rich and the poor as the most severe disease of our world, even more when the lack of economical resources hinders the right to healthcare of the poorest. However, this should prevail over everything, as Saint Benedict wrote in among his rules. I think that the choice of discussing this core topic of healthcare poverty in the world is very important, especially in the city, which is the heart of Christianity, and in such saint and sacred events, a sacred place like the churches, where the Holy Spirit welcomes us. And I am close to all of you, to all the sick and their caregivers who will cross the holy door today, a door which gives access to grace. And to all of you, I would like to witness how much faith is the ultimate medicine, because throughout faith, pain is healed. And I also want to acknowledge my gratitude to all the nurses. Your adventure, your mission is challenging, but it requires also a lot of passion, and it is not sufficiently rewarded. It is an indispensable social work that requires you to be for the body, a hand of assistance, but also a helping hand and a psychologist, which is also a generous colleague of existence and a dear friend. And to conclude, I want to mention Nightingale, who underlined how much nursing is an art, because it requires an exclusive devotion, a hard preparation, as from the work of any painter or sculptor, with the only difference that you do not have to do with a dead canvas or cold marble, but with a human, a living body, the temple of God's Spirit in its fine art.
Grazie, Dr. Farinet.
Thank you, Mr. Farinet, for these words, for your words and the words of Andrea Bocelli. As a moderator, I normally make mistakes also on private fields. And I said Giovanotti, who is a different artist, but I I got mixed up, and there's a reason, because this morning I went to see an exhibition at the Vatican Library, which is introduced by the bicycle of Giovanotti and some of his notes. So let's put together these events we have heard today by saying that we need art, music and other art. I think about the beauty of the witnessed by those who went to this concert event on the 7th of December. Some of you are acknowledging this. This is the fact of Mary in the Sistine corridors and wards, and this was harked back to times past, and perhaps nowadays we don't have enough resources, but we can make up for that with the beauty which is very well represented here. Thank you for your words. And now the greeting of Cardinal Matteo Zuppi, who is the president of the Italian Bishops' Conference and Archbishop of Bologna, who sent us a video. I would like to greet you all those participating to the meeting Many Worlds, One Health, which is taking place today in Rome. If last November our gaze was looking to Europe, today it widens to the entire world. Francis of Assisi gave the correct perspective to this gaze. We are all creatures of God, and the many worlds we belong to have their own beauty, which is unitary in nature and with its own grace to steward, as well as the beauty of creation deriving from cosmic order. The first impact in each one of us should be gratitude. And though this is often the last feeling we have, and often we tend to be much more repetitive in complaining. This meeting is the result of a collaboration with the federations and the national councils of the healthcare professional orders, and it is a three-stage itinerary. Last 24th of May in Verona last year, looking at Italy, and then in November on healthcare poverty in Europe. This gaze is now open to the entire world. Every man is a wayfarer. Our lives proceed, and everyone is shaped by meetings and choices, and we orient our steps, and all together we bestow gifts on one another. And when our steps are directed by the Lord Jesus, we have a further guide in order to read the personal and human history, to read the signs of the time, to penetrate within history. Whether if humanity belongs to this world, biologically speaking, for the spiritual side of things, is closer to God. And it is true that we are made in his likeness. We have a life which is completely spiritual, even though wars, suffering, and famine, the clamming in of our individualism makes us forget this. Practical materialism. Thus, what is spiritual is shut away in a dimension which is far away from our life and does not allow it to be oriented by it. By this spiritual dimension, a few remits derive, including that of our own and everyone's healthcare. The question as to who the person to love is, who my neighbor is, and this was somebody who didn't feel like putting too much effort into it, and we too keep on asking our question because we don't want to take on the answer, who is my neighbor, who is my brother, who is my sister? Now this question cannot and must not leave anybody behind. We are all co-responsible. History teaches us that only by taking on this responsibility will we be able to translate into concrete action two fundamental issues: hope and peace. Our hands, our minds, our will, and our heart are entrusted to hope. Jubilee is not a thing. It's a new modulation of our soul, which resonates in the hope that things may change, and at the same time affirms that hope does not disappoint. Let us look at the hope emanating from the cross and the resurrection of Christ, and that hope that Paul summarizes in few and powerful words. The last enemy to be destroyed is death. This is the letter to the Christians of Corinth, speaking about the resurrection of Christ, the first of the risen ones. This is a very concrete outlook, though it may appear distant. But it is the viewpoint that teaches us that hope is a relationship of cooperation among us, each one of us, and the Lord of life. To this, we should also add the building of peace, which certainly goes through the will of those who govern us and their desire to form this. And then, of course, to building, though there are few workmen, and our being, each one of us, builders of peace. Each one of us must and should be an active actor in the resolution of social conflicts in order to build a world in greater solidarity and greater peace. It is up to us to take on the sufferings and the questions of humanity asking for answers. In an international meeting of healthcare professionals, it should not sound out of place to speak about peace. And from the dialogue at various levels, in the conversation between interlocutors at various levels, we will see the coming about of shared words and destinies. Let's try and imagine the suffering and the pain suffered by the wounded, the mourning created by the deaths, the wounds of the mind which will remain in our living past unforgettable. Peace is the fruit of a conversion of the heart. Today, all the federations and the national councils are represented, and there are international speakers whom I thank for being here. And to all of you, please receive my greeting and thanks. I wish a profitable outcome to this meeting in the sign of seeking one health, just one, because it belongs to everyone. It was gifted to us, and we need to be, on the one hand, jealous stewards and active actors. Thank you. I was impressed by one expression by Cardinal Zuppi, and we ask Father Massimo to thank him on behalf of this assembly. When he said gratitude, we hear people thank us when, as professionals, people ask us to help them, or just when we listen to people. But sometimes, as professionals, we don't thank those who have entrusted themselves to us, and this attitude of gratitude should be mutual. Gratitude seems to be taken for granted, but ingratitude, lack of gratitude, is more frequent. But let's be positive and let's launch a campaign for gratitude. Thank you kindly for all this. And we move on to our content proper, with data supplied to us with the next speakers. The first one is Madam Natasha Azzopardi-Muscat, who is the Director for the Division of National Healthcare Policies of the World Health Organization Region Europe. She would have liked to be here with us. She was not able to attend, and she has sent us a video contribution. This will be in the English language, so if you require translations, please use your headsets and your receivers now.
Buongiorno, sono Natasha e sono la direttrice del reparto delle politiche e sistemi sanitari all'OMS Europa. Sono particolarmente felice ed onorata di poter partecipare a questo convegno dal titolo Many Worlds, One Health. E ringrazio la Commissione Episcopale per il servizio della carità e la salute e anche tutte le federazioni e i consigli nazionali italiani che operano in sanità e nei servizi sociali. Saluto
I would like to greet Mr. Andrea Farinet, Cardinal Matteo Zuppi, Mr. Giovanni Leonardi, Romani Marabelli, and allow me to also greet Monsignor Massimo Angelelli, with whom the World Health Organization has shared the first two events on healthcare organized in the last few months in preparation for this jubilee of sick persons and healthcare professionals, which we celebrate together. Allow me also to greet each one of you, all the women and the men of healthcare personnel. You are the pillars of our healthcare systems, and we need to continue to support you. I'm sorry not to be able to be with you in person, but I truly wanted to greet you on a personal level and on the part of my WHO Europe office. And now, if you allow me, I shall continue presenting in English.
To share with you some of the key findings from our recently launched European Health Report, Keeping Health High on the Agenda. And let us start with a topic which I know is very important for you in Italy. Of course, you have reason to celebrate. You have one of the oldest populations in the world. But with aging also come certain challenges. And let us start just by taking this brief look. On average, across the WHO European region, which is made up of 53 member states extending also into Central Asia, we see that women live on average 79 years, whilst men on average 73 years. But more importantly, of those years, women spend more than 12 years in poor health and men almost 9 years in poor health. And nearly half of older persons with severe self-care difficulties do not still get the help they need. So they are unable to live well and to participate fully in society. And this, of course, is an important issue for all of us who believe that at all ages we should respect the dignity of people. How will we age better? Well, it all starts in childhood, the very foundations. But let me just tell you that 76,000 children across our region die before their 5th birthday. Some of them also die in childbirth. And next Monday, on the 7th April, we will be drawing attention to the fact that still across the region we have maternal deaths that are preventable. And when it comes to child mortality, there is a 21-fold difference. So inequity across our region looms large. Moving now to young people who face several important and emerging challenges. Let me just say that almost a quarter of children and young people amongst our region, now adolescents, use e-cigarettes. This is, of course, a concerning issue. But moving to the bigger issue that everybody is talking about, the health and well-being of adolescents, of children, and of young people. We know that life satisfaction has declined over the past 5 years. So COVID pandemic hit children and young people particularly badly when it comes to their mental health. they have not bounced back. And we know also that the mental health and well-being of girls is generally worse than that of boys across the region. And next Monday I shall be in Poland, where we shall be launching our evidence review on the digital determinants of health. And again, this is an area which all member states are grappling with. On a sober note, the leading cause of deaths in adolescents and young adults aged 15 to 29 years old across our region is suicide. And then across all age groups, men are 4 times more affected than women. But women and young girls, and this is also a topic of concern in the digital age, are experiencing violence. 1 out of 4 women and girls experience violence in their lifetime. And we are very grateful also to the Minister of Health, Orazio Schillaci, who has supported the campaign and special initiative launched by our regional director, Dr. Hans Kluge, to put this high on the agenda, because as the health sector, we have a role to play. We have a role to play in preventing, identifying early on, and referring appropriately victims. We also have a role to play to ensure that our healthcare workers, a huge portion of whom are women, do not experience violence at their place of work. Zero tolerance to violence. But let me come to another important health challenge: infectious diseases. Diseases that should have been a thing of the past are making a comeback in the European region. We are seeing a resurgence linked to a lack of trust in vaccines and misinformation and disinformation, such that we had 58,000 cases of measles in 2023 and 87,000 cases of pertussis. And unfortunately, of course, this also means that a few children die. We still have gaps in vaccination coverage. And of course, these regional averages mask disparities. There are countries in our region that have only achieved a low 62% coverage target for measles. And here, as healthcare workers, we have an important role to play. But of course, the largest burden is undoubtedly non-communicable diseases. Cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases cause 1 out of 6 people across our region to die before the age of 70. And of course, the sad and tragic element to all of this is that many of these diseases are preventable. You see in the photo the blood pressure measurement being taken. Across our region, hypertension still remains in many countries not fully diagnosed, not treated, or not treated to target. These are gaps that can and should be closed. We have a number of risk factors that we are still struggling with. Tobacco use. 1 out of every 4 adults is a user of tobacco. And as the region, the European region, we also have the world's highest per capita alcohol consumption. And obesity is still a challenge and has increased over the past decade and now affects nearly 25% of all adults. As though this was not enough, we also have now this new challenge, which of course in Italy, particularly in the southern parts, you are experiencing. And it is putting a challenge also on the health workers, who traditionally used to have some respite in the summer months, but not any longer with climate change, heat exposure. And in 2022, we had 61,000 heat-related deaths, of course, concentrated in certain parts of our region. And here again, older people and people with non-communicable diseases are the most affected. So, of course, all health systems are struggling and are in need of transformation. And we look, for example, towards digital technologies and AI as being part of the solution. But the true spirit of our healthcare systems lies with the humanity that only health workers can give. You can see that the health workforce density in Italy, we have almost half of doctors being female, but then more than 3/4 of the nurses are women. And then we know that we have some challenges also when it comes, for example, to the aging health workforce. And over here, when it comes to medical doctors, Italy wins the first prize in terms of its rapidly aging medical workforce. And when we look at the distribution, not all specialties are aging equally fast. And in many countries across our region, what we are finding is that people who work in primary care, medici del territorio, are aging amongst the fastest and are not being replaced by younger doctors who may be less willing to work in rural areas, giving rise to inequities. And when it comes to nursing, I would like to share another slide. This is from OECD countries that show that the number of young people who want to take up nursing studies continues to decline. And you can see at the right end of the slide that Italy actually has one of the lowest rates of young people saying that they would like to take up nursing studies. So, of course, this is a crisis, and we are very grateful that Italy has joined our EU-funded nursing action with two main aims: to retain and to recruit. And we look forward to working with you. But let me wrap up by referring also to the fact that we understand that the mental health of health workers is also a key priority and an area where we are struggling. And in this sense, we are delighted that we have launched a first ever European survey on the mental health of healthcare workers, focusing on doctors and on nurses, to try to take a snapshot to describe the mental health and well-being of doctors and nurses across the EU countries, Iceland and Norway. And we want to analyze the association between mental health outcomes and socio-demographic and workplace-related factors. And in this sense, I would like to remind everyone that the closing date is the 6th of April. And I would like to thank FNOPI particularly for your support. And in terms of absolute numbers, as I speak, the responses from Italian nurses are the highest among all countries. So thank you and well done for this. And of course, finally, I must ask that we all remain extremely vigilant, active, and continue to advocate for health. In dark times for Europe, where we are seeing a shift onto defense spending away from spending on social welfare, let us not forget that this will mean that we will continue to see people having to spend more out of pocket. This impacts mostly on those people who are towards the bottom of the income earnings pyramid. And already we know that up to 21% of households in our region experience catastrophic health spending. What does this mean? This means that every month in these households, people have to choose whether to put their money on health, on food, on housing, on utilities and basic necessities. So we need to ensure that in this climate we continue to protect as best as we can our health expenditure, particularly protecting the poorest households who are amongst those that are most affected. You can read the full findings from the European Health Report at this link, which is present here in the slide. I thank you once again on behalf of WHO Euro for having given me this opportunity to share a few reflections with you, and I wish you all the best with the ongoing celebrations of the Golden Jubilee. Grazie.
C'è davvero da ringraziare.
We should truly thank Madam Azzopardi Muscat because she shared a very significant framework. I was especially impressed by some figures about our younger generations who are truly our hope for the future, and some concerning elements such as the data about the rate of suicides, as well as some kind of worry about the future that we can truly perceive among our younger generations, because they are not inspired to take action, because they think that in 10 years the world will be over. So it has become some kind of refrain, and this reveals, I wouldn't say a real despair, but a lack of hope. And another thing, I don't know, Don Massimo, if you were also impressed by that, we also heard that in last November from Madam Zopina, and she said that our patients need, our sick people need humanity, and we have to transfer that. So it's not only the technical and scientific component, but we should also share our humanity, which is not an additional component. It's not an optional component, but it's an integral part. And she also mentioned the aspect of mental health. 2 days ago, we had a conference about this topic, and over 8 hours and 45 minutes, and I had to moderate that. It was really tiring for me to stick to our timeline, but we were really good. We were only 10 minutes late at the end of the day. So we heard a lot of interesting data and interesting insights, by the fact that many members of public bodies and the government also had a chance to listen to those is extremely relevant, especially for caregivers. So we should say that we also need some care, we also need gratitude. And I think that call was really important for us too. I don't know if you want to add anything, Don Massimo. Well, Jenny, please be good. Any time that we hint at the human aspect of care, I am in conflict with myself, because this is something we cannot avoid. I mean, how could you say something different? But the humanization of care, in my humble opinion, has almost become a kind of alternative approach. It can mean anything, but basically, once again, we should try to understand what that means, from the color of the rooms to the paths and journeys towards the healing. It may be trivial, but I think that it truly revolves around our relationships. If our relationships are robust, if the way we take care of others is robust, maybe even if we are healing in facilities which are not that good, and that well good looking, we can still transfer the idea that someone is listening to that patient, is taking care of that patient. And I'm very well that it's important to consider the tools, the resources, the places, the facilities. Of course, those are important, but I have also experienced in my own life, in the places where I've been trained and accompanied in my clinical path, I think that in the relationship, it all comes down to the relationship, and there's no way to avoid that. I believe, and I also sees that when Gianni mentioned our event from 2 days ago. 2 days ago, this room was filled with healthcare, mental health professionals, and the figures are truly concerning in that field as well. What's happening? I think that you are the most important barometer of history, because you talk to people who are suffering. So beyond any strategy or technique or plan or program, you should help us to read the reality, because there's a hidden layer of suffering in our society. Madame Muscat also mentioned suicide rates, which have never been as high. We are also seeing a lot of eating disorders, the onset of some diseases of self-harm, self-injuries at very early age. And I believe that all this are signals for us. We have to meet those needs, and we cannot ignore that. We have social media, we have TikTok, we have TV programs like Big Brother, but it looks like we are turning our eyes away from reality. You should speak up, because I think you are on the first line. You heal the injuries of people, and the figures that we are seeing should be the core of our advocacy activity, so that they are taken care of appropriately. Thank you, Don Massimo. You mentioned once again the importance of relationships. This has been fascinating us for over the past few years. And I believe that relationships, good relationships, also have an economic value. And let's just think of how often good relationships can avoid going in front of a court, because any professional may make a mistake, but the fact that you do not provide an appropriate answer is damaging for both the professionals and the patients. This morning we hosted another event on advocacy actions in this very room, so I think that good relationships in terms of healthy replies, healthy support, are also an effective answer to this need. So let's now move to a new speech. We have Mr. Michael Marcotte, who shared the video with us. He's the director of the International Institute for Health in London and the president for the Commission for Social Determinants on Health from the World Health Organization. So let's now have a listen to his video.
Love visiting Rome. The fact that I'm not here in person means that, regrettably, it was not possible for me to come. Otherwise, you would have had my enthusiastic participation. I look forward to the next time. The Gallup organization in 2022 surveyed people in 64 countries, and they asked the question, do you think children today will have a better life, about the same, or a worse life to you? In Europe, about 30% of adults said today's children will have a better life than they. And about 34% said a worse life. It varied a bit among European countries. It was higher in South Asia, Sub-Saharan Africa, perhaps because as in Europe, if you'd asked that question after World War II, if you'd asked my parents, will your children have a better life than you? If you'd asked most Italian parents, will your children have a better life than you? My guess is they would have said yes. And they would have been right. Because children would survive, infant and child mortality went down, they would get health care, they'd get good education, more of them would go on to tertiary education, there were economic opportunities, better housing conditions, things were improving. But today's adults, only a minority, think that children will have a better life than they. What have we wrought? And I'm guessing now, I'm speculating, that if you factored in the environmental emergency, the threat to the planet, then people would have said the prospects for their children were even lower. Wow. Today's generation has said, we have messed it up for our children. And if we want to talk about health in the context of sustainability, it is urgent. What could be more urgent than addressing prospects for our children? One way of looking at prospects for our children is to look at social mobility. What we know is that, in general, rich parents have rich children when the children become adults. Poor parents have poor children when those children grow up. And middle-income parents have middle-income children. One way of measuring social mobility is to ask the question, at today's rate of social mobility, how many generations would it take for someone at the 10th centile of income to, when they are an adult, achieve the median, the 50th centile? Yeah? So born into the 10th centile, how many generations would it take to get to the median, the 50th centile? In Denmark, it would take 2 generations. In Norway, Finland, Sweden, it would take 3 generations. In the UK and the US, 5 generations. In Brazil, 9. Why this difference? Why is it that poverty is more likely to be destiny in the UK and the US, and I would add Italy, than in the Nordic countries? There are 2 classes of explanation. The magnitude of income inequality. The bigger the income inequality, the less social mobility there is, the harder it is for a child to climb the ladder. And investment in young children. If we look at OECD figures, the average investment in children age 0 to 5 is $6,000 per child per year at purchasing power parities. The Nordic countries, Norway is about 12,000. Sweden, Finland, Denmark, about 9, France. The average is 6. The UK is a bit below that. The US is 3,000. Italy towards the lower end of that scale. Why is this important? Why am I talking to you about children? Because it's fundamental. What happens in early childhood sets the framework for health in later life and for health inequalities in later life. To reduce health inequalities in later life, the time to begin is in the first 1,000 days of life. certainly in preschool. And we really are messing it up for our children. The problem with what I just told you about social mobility is if someone rises up, it probably means somebody else is going down. We need to improve things for everyone. And that means investing in early childhood so that all children have a chance to flourish. And one way of doing that is to reduce child poverty. If we reduce child poverty, it means we're reducing adult poverty. If we define, as the OECD does, child poverty at living in a household at less than 60% median income, I'm afraid Italy doesn't look so good. The UK looks very bad. In fact, in the UK, from the period of 2010 over the next dozen years after 2010, we had the fastest rise in child poverty of any OECD country. So if we take the steps to reduce child poverty, it means we will reduce poverty for people of childbearing age. And that will be good for their health. If I look at the UK, what's happened in the UK, in the period from around 2009, just after the global financial crisis, to 2023, after the impact of the COVID pandemic, a 14-year period, life expectancy did not improve at all. Things are not improving. This is appalling. There's been a slowdown all over Europe, but worse in the UK than in other European countries. The only other big country that looks worse than the UK is the United States. What are we going to do to deal with this? In my Marmot Review of 2010, Health Inequalities in England, and the Marmot Review 10 years on, published in 2020, and subsequently, we had initially 6, now 8 domains of recommendations to deal with health inequalities. Give every child the best start in life. Education and lifelong learning. Number 3, employment and working conditions. Number 4, everyone should have at least the minimum income necessary for a healthy life. Number 5, healthy and sustainable places in which to live and work, including housing. Number 6, taking a social determinants approach to prevention. And the 2 that we've added tackle racism, discrimination, and their outcomes. And number 8, pursue environmental sustainability and health equity together. We are at something of a crisis globally. I'm co-chairing a high-level council set up by UNAIDS on inequality, AIDS, and pandemics, co-chairing it with Joe Stiglitz, Nobel Prize-winning economist, Monica Gingos, the former First Lady of Namibia. Joe Stiglitz gave me a copy of his most recent book, The Road to Freedom. In it, he is essentially saying, along with other authors, that the neoliberal order that was ushered in by Friedrich Hayek's Road to Serfdom is over. It stopped working. The reliance on free markets is no longer sufficient to meet people's needs. And he has a series of recommendations, one of which chimes with my own views, which is the vital importance of rediscovering the public good. This means government, but it also means the voluntary community and faith sectors. It means business. It means other public organizations. The faith sector can be, should be, a force for good for improving the quality of people's lives that will improve their prospects for good health. I said we are at a difficult moment. What gives me grounds for hope? In England, Wales, and Scotland, we have 50 Marmot places. These are places that have taken my 8 recommendations and said, this is the basis for planning. You notice I haven't mentioned the healthcare system, but of course that's included. For planning at the city level, with all the actors that I mentioned before, the voluntary community and faith sector, the health and care sector, business, other public bodies. 50. Wales recently declared they want to become a Marmot nation. I'm delighted that the National Institute for Public Health in Italy, in Rome, has launched an Italian network of cities based on Marmot principles. We need central action by government, but local action is absolutely vital too. Working together with people operating with the aim of social justice, using the best evidence, we can be hopeful about a future with better health and narrower health inequalities.
Grazie al dottor Marmo.
We thank Mr. Marmot, and one of the aspects that he mentioned is the income inequality that Mr. Farinet also mentioned in his speech. But it's not only that. But I would like to ask you to comment on this speech. Thank you. I wanted to start from an anecdote because we mentioned gratitude, belonging in healthcare. So I would like to start from an anecdote from 1990. I was a professor at the Bocconi University. I had been introduced by my professor in some courses. I was said at that time that I had 5 years left. I was taken care of, and at that time when I received the diagnosis, it was not easy to come back home on that night. And why I'm saying that? Because in our foundation, we are fighting on identifying on empathy. Our payoff is being the others. So I divide humanity between those who have received a diagnosis of non-treatable disease and those who haven't. So when you are in front of this yellow light, sometimes tell me, are you taking any drugs? Well, I'm not taking drugs. I'm happy because I had to die in 1995. So what I'm doing today is taking a train, going to Rome for this jubilee. So after such a diagnosis, you really have a passion to fight for these topics. But is health the absence of symptoms or a quality for a different of the quality of life? And I want to share some good news with you before wrapping up. Last week, we launched a campaign here in Rome, a campaign on importance of therapeutic adherence, which is an essential element. Cardiovascular diseases need to be tackled. We launched many campaigns against various tumors. We have 1,000 diagnoses of tumor in Italy. We were contacted by Italy's Neurology Association on the topic of neurological disorders, which are extremely high, especially among younger generations. I am now a professor of social psychology and neuropathology, and we truly need to dive deeper into these topics. 40% of younger generations are asking for psychological support. And after COVID, the use of psychodrugs has increased by 50%. And what are we doing? This determines a decrease in our in the quality on energetic quality. My son is studying philosophy, and he said, we were sold in our future. No one is listening to us. What's our future? We listen to people talking of World War III and mentioning the number of deaths as if it was something normal, but the sacred character of life, of others, is where have all these elements gone. There's a social justice, and you saw what happened in the markets over the past few days, because all the funds, investment funds, decided they want to get even more money. I've recently visited a great facility, and I was moved by a man asking for an appointment for his father, and he was told that he had to wait 1 year for an appointment. And I think this goes against our constitution. This goes against our constitution because Article 3 of our constitution states that all citizens have equal social dignity. But this is missing now. So we have to work hard because we have to change this. I won't go into the technical details of the economic framework because I've already mentioned that. Mr. Marmot mentioned the challenges of going up the social ladder, and our younger generations are seeing that. Yes, you remember there was this social lift. Those who are older among you will remember that after studying, you could get a job, buy a house. There was some kind of growth. But this social lift is no longer there. This social lift is no longer there. I'm officially saying that to you. How many Italians are able to save money? We have very low numbers. And how many Italians are looking to the future with confidence? 50% of our young people are pessimistic. But what should we do if they have no hope for the future? So this is our social poison. This is poisoning our lives. And the environment, art, and soul should be at the center of our programs, but we can't go back home thinking that the north of Italy has increased numbers of premature deaths. So who is standing up and speaking up saying that we have to fight this? Public health concerns us all, and I think we've all gone mad. I think that in Professor Marmot's words, we can also see some kind of weakness from the WHO and other bodies. Can we do something about that? In 2 days, I will meet a former student of mine, Serena Pirondini. She's currently manager of women's rights on a global level, and all UN offices in the world are closing. Because with the cuts from president terms, they are closing all these offices. And I think it's a shame. How can we support people living from this kind of work? How can we assist them? We need strong voices. Thank you. Don Massimo, just a few words. Can I ask that? It's at a point, Mr. Marmot mentioned the aspect of faith, who should help this. And since the title of our conference is Many Worlds, once faith had created hope for a new world, so we're witnessing a change of paradigm.
Anche quello al di qua.
Yes, and there is a world over there, but there's also a world over here. Faith has always been seen as something, at least lately, which has been caricatured somewhat. But the other day, with the Jubilee of Mental Health, I was noting a distinction which may bore you, but I'm going to offer it to you anyway. But it always helps me a lot. The spiritual dimension is that dimension pertaining to every man, woman living in history, and an anthropological dimension. It belongs to the person throughout the history of humanity, from its very dawn up until recent times and recent places. At any latitude, men and women have always felt a natural aspiration to relate with some third party. Without them, outside of them. These have different forms, different dimensions, but this spiritual attention and tension has always existed. In some cases, the spiritual dimension takes on the religious cloak, and religion means that there is a moral package and a ritual package, which means that when we all agree on some moral component, what is right and what is wrong for me, and we agree, and then when there is a ritual protocol around this, we have a religion, a religious dimension. But the religious dimension is the expression of the spiritual dimension. Otherwise, this gap may be dangerous, and I'll tell you why. The third level is that of identity. That's to say that I incarnate my religion. So I have chosen the Catholic form of my believing, which descends and is incarnate in a spiritual dimension. For me, religion is not cultural nor moral, but it's a person. I have a precise reference in the person of Jesus Christ, who is my religious form, my spiritual dimension, my moral apparatus. Why am I making this distinction? Because if we keep trying, as we have tried to cancel religion, we have depressed the spiritual dimension. This means that, in other words, somebody is so bothered by the religious dimension, though I've no idea why, that even the spiritual dimension has been depressed, and this has created a flattening of humanity within a very sad and depressing dimension. We just need to buy and consume in order to buy more. This has generated a dimension of cross-board dissatisfaction, which then spills out in many aspects of our lives. The culture of beauty has been lost. The culture of what is true has been lost. We are not horrified before certain things. We are not shocked. And that's because our spiritual dimension has been compressed when not denied. Recovering this means reopening a horizon of meaning through a gesture of care. It is a gesture of care today to meet in order to be able to freely speak. Allow me a lighter tone, otherwise our afternoon will be intolerable. But when you came in, they asked you if you were enrolled. We didn't want your certificate of baptism. So potentially, a few unbaptized people have entered this very place. Hey, that's probably normal. Do we need a baptismal certificate to come here and talk among men and women? That's not what I thought. That was not my intention. We need to elevate our dimension of the spirit. We need to learn to be able to look beyond this only limited horizon, or we will compress and flatten the meaning of things. The poverties coming about, we don't want to see them. We just don't want to see them. I remember during a briefing at an emergency section of a well-known hospital out in the countryside in Rome. I won't mention its name, but I'm sure you know the one I mean. It's amongst the sheep. Anyway, there was a video there. But during a briefing session on issues pertaining to accident and emergency, we were speaking of the topic of homeless people who came to A&E. And I remember a reflection on a very difficult question, a very difficult question. When you look after somebody who is smelly because they come from the street, whereas others who are well dressed and nicely fragranced, is this the same thing? Well, it's not pleasant to look after somebody who smells. Let's not pretend that it's the same thing. It's harder. We need a greater effort, a greater attention of care. We need to be more caring, careful, and perhaps this is the time of quoting the failure of the theme of equality, the theme of egalitarianism, which is a difficult word to pronounce, is something which has failed. And the Professor Marmot and Professor Azzopardi have tabled the theme of equity. This is the challenge we need to rise up to today. We talk about persons as though they're all interchangeable, but no, it's not true. And my alerts tell me that we are going to into a situation which is less and less equal. The social mobility ladder has failed. Those who have money can look after themselves better, and there is no mobility because somebody has decided that nobody should ascend. We're up in the attic, we're okay, amongst friends, we're going to close the social mobility escalator, the social mobility lift, and we're going to stay up here nice and cozy. Nobody should be able to disturb us. I believe that these reflections are certainly the level we are tabling and working on. As I prepared this day in friendship, Gianni, I'm going to say the risk here is to be a little bit theoretical because the first two stages were very nice, and my impression was that somehow we had detached from reality. We were in rarefied air. But by listening to you and listening to your contributions, I felt that this is the level of reflection and interlocution we need to aim for. We need to aim for the high level, because if we keep worrying about practical problems like the waiting lists, which are real problems, of course, but we are not looking at the entirety of reality. We are denying the situation on the ground. So thank you for giving us a chance to share all of this. Thank you. Thank you, Don Massimo, and I can witness that what is happening at this point in time was not pre-cooked, meaning that these are topics that we are tasting as we go along, and they have been on our plate for quite some time. It seems to me that before certain signs of lack of hope, we have found many open doors. We will go through one specific open door soon, but thanks to the professionals who are surrounding us, many doors have been opened. On to the next contribution. Dr. Giovanni Lonardi, who is from the Department of Human, Animal and Ecosystem Health of the International Relations Ministry of Healthcare in Italy. He has spoken to us before, and we're happy to listen to him once again. Good evening, everyone. Good evening, Monsignor Angelelli. Thank you for this further invitation. I was here a couple of days ago for the Jubilee of Mental Health, and here I am again. It is clearly a pleasure to meet these professionals, many many known faces. I was also a director in a healthcare trust, and there are a few white hairs which we have shared together many times, spent together. I know many of you, and therefore it's truly a pleasure to be here. I am not as pessimistic as some of us. I am part of the idiots party. I know that some optimists may be idiots, but the glass is always half full for me, and all in all, our world is undergoing a difficult time, but having seen history, Italians have never been as well as they are today. If we think about the Italy in the 50s, things are not too bad today. Of course, there is a deep crisis. I'm not denying this, but I think that we still have energy, and this we need to transmit to young people. We have the energy to relaunch things, and I truly believe in this. And I believe that healthcare could be the engine of all this. Sorry about this reflection, but I could not resist the input on the part of our moderators. Healthcare can be the engine of development. We understood that Made in Italy is made through life sciences as an industry, and this is the locomotive, and we need to bear this in mind because this will bring ahead public-private partnerships in a healthy manner and allow us to give us a sustainable development such as that of life sciences. Having said this, today I have been asked to speak about, I think these are the wrong slides actually. These are the ones from the day before yesterday. And I did not project these the other days because our moderator shortened our time available. I'm just going to look for the correct slides.
Ricordavo, mi pagano per minuto.
Yes, because there is a fine every time I'm late. Let me explain this time frame issue. In our meetings, we love to chat, and we always begin a bit late. We finish even later. In this case, as our day will end with the symbolic crossing of the threshold, that door is just gonna shut on us. So my problem is to, if we all set off late, the holy door will be shut on us, and that would be a devastating metaphor. And that's not a good omen. But we are within our time frames. We can take it easy. Gianni was moderated in turn. We are following our schedule, and therefore over we go. I don't want to exact my revenge, and I won't interrupt you today, but I know what I'm up against. Anyway, the topic is many words and One Health. As I am the director of the One Health department, I was asked to illustrate this topic. I am speaking before an audience of professionals. Just let me get my bearings.
Grazie. Eccoci. Allora, questa è una slide che sicuramente
This is a slide you probably know as professionals. One Health is part of a concentric circle setup. The theme of public health, which is fundamental, and alongside global health on the one hand. Public health is the public health policies, the ones we're talking about. Global health is when these policies require a more international dimension, because one single country isn't able to deal with this. And then the connection between human, animal, and environmental health is that which we define as One Health. Finally, there is planetary health, which includes the overall sustainability balance of the planet with socioeconomic and social determinants. So a general balance in our planet for the health not only of people, but also of plants, of the planet, and animals. Coming to One Health, which is the one which falls within the purview of the healthcare system. In 2021, the World Health Organization in General Assembly decided to give further thrust to the already started synergy between World Health Organization, FAO, and used to be OIE for Animal Health, now OMSA, to work on the One Health approach. Then UNEP joined the group for the protection of the environment. That's the United Nations agency. So this four-fold party in 2022 gave rise to the One Health Joint Plan. This plan has 6 fundamental indications. On the one hand, it strengthened the One Health approach because we are aware that circularity, the connection between these 3 components of the human, the animal, and the environment are fundamental. Thus, to reduce the risk of epidemics and pandemics from animal origin, to control infections which are vector transmitted. This is clearly topical in our country. And then the issue linked to the assessment and management of food-based risk to fight the antimicrobic resistance and integrating the One Health approach. This has been with us from 2022 and should end in 2026. These other documents from the WHO are crucial: the United Nations 2030 Millennium Development Goals and the Green Deal, which, as you know, has given further trust to a transdisciplinary cooperation in order to have a circular vision to health. On top of this, G7, having seen Italy as in the presidency seat last year, and Italy was able to reiterate the 2021 G20 Italian presidency and focused its attention on 3 priorities: global health, which we talked about earlier, active aging, another crucial topic, and the One Health approach, specifically in terms of the antimicrobic resistance. These were the 3 topics of the Italian G7 presidency.
Our ministry, as you know well, and I'm now diving deeper into the core topic of my presentation, because of course this One Health approach needs to be translated into practice. As I was saying, the ministry created a dedicated department. In 2023, we have 4 sub-departments. So from a single Secretary General, we shifted to 4 directions, 4 departments, one for the general administration, one from research and emergency, and the final one for the One Health, which focuses on correct lifestyle, on fragility, and the topic of animal health and food hygiene and food safety. Another element that I want to highlight is that our unit groups a series of fields which are, of course, interconnected. And of course, One Health goes beyond the scope of this department as well, since the One Health approach goes beyond the ministry, beyond health itself. So we have aspects of veterinary health, pollution, and the environment, which is part of the Ministry of Health, research on these topics, the protection of fragilities, mental health, addictions, disabilities, healthcare in prisons. Of course, these topics and subjects are covered by our department, by our unit, the whole topic of animal health, fast alert systems for both animal and food emergencies, exports, and collaboration for and cooperation for development. We have a dedicated mission collaborating with the Foreign Affairs Ministry, and that connects us back to the issues of global health. So, as I was saying, our department, our unit cannot work on its own. We have an interinstitutional collaboration within the Ministry of Health itself. Our colleague Carpitiello 2 days ago mentioned the Prevention Hub, which is a body created within the Prevention Department. And of course, the One Health Department works in collaboration with the Prevention Department to draft prevention policies and guidelines in a single framework. And this interfield collaboration with other institutions as well, such as the Civil Protection, the national associations, and with our international partners within the four-party agreement that we mentioned before. We also have an intergroup at the Italian Parliament from with MPs that gather to discuss all issues under the umbrella of One Health. As for interinstitutional collaborations, I won't mention them all. You have a list on screen. But of course, we have a close collaboration with the Ministry of Environment. We have a directorate which reports directly to the Department of Innovation at the Presidency of the Council of Ministers. We work with the departments of addictions and disabilities as well. We work also with the Ministry for Social Policies, for Employment, with the Ministry for Education, because of course our intervention school is equally essential, so that we can have an active engagement from the early ages too. We also have a whole series of collaborations with voluntary associations, organizations, and universities too. I would like to focus on two specific projects to show you what are the real-world subjects we are addressing. The first one is the Health and Environment Project, a plan that we drafted together with the National Recovery Plan with national funds. This project aims at putting together the environmental supply chain, the Prevention Department, the Ministry, and all the actions around the environment, and on the other hand, all the organizations and bodies working on environmental protection throughout the Italian territory. These are our 5 targets: the creation of a system to prevent environmental risks and climate risks, which integrates with the Prevention Department, some pilot programs to have active policies in the environment, basic university level training programs to provide continued professional development, research applications, and a digital platform to put together data and make it available to everyone. These are some projects that I just wanted to showcase because it may be useful for some of you. The training program was drafted by Italy's National Health Institute. It has already been published. And the digital platform that I mentioned, the IDEA platform, that offers a comprehensive overview of data. And I will wrap up by mentioning another important project, the National Plan Against Antibiotic Resistance, which is taken as a paradigm of the One Health approach, because this plan stems from the activity of the prevention department, but it is strictly connected to the One Health approach. It aims at strengthening the One Health approach, promoting monitoring and prevention, promoting an appropriate use of antibiotic drugs, improving research and innovation, raising awareness among the general population, and promoting national and international cooperation among the stakeholders. As you can see in this slide, the actions in this plan focus on human health, environmental health, and veterinary health. So this truly is a place to work together concretely on this comprehensive approach. This may look theoretical, however, this has real-world applications too. And I will seize the chance of being in front of so many professionals to reiterate that this One Health approach has to be promoted by professionals first. I meet veterinarians very often, and I do really think that they have been the pioneers in the One Health approach. They were still working on this approach when it was in its very early stages. However, being a pioneer is one thing, but being the exclusive owners is completely different. So this is why we stress the importance of a transdisciplinary approach. This touches upon the fields of education, environment, research, and engineering overall. So we have to promote this approach while being aware that even though this originates from the world of healthcare, it has to encompass many other areas, because we have to promote this in all the environments and areas. Thank you. Thank you, Mr. Leonardi. If I may, you've been very good at keeping tied to the schedule. You said you're an optimist, so please share with us a few more signs of hope, because if we look at the One Health approach, it looks like the dangers come from the international scenario, because wars, geopolitical tensions create new risks. So what are the dangers for us? Well, of course, being an optimist does not mean being idiots. It means having an optimistic perspective, because sometimes that may hinder our actions. Previously, we were mentioning the situation in the north of Italy. That is a huge concern. We have some proceedings that we are discussing with the European Union so that we can tackle pollution, air pollution in general, and of course, pollution in the areas where stronger action is needed. Then, of course, there are some things we do not have power on, but I think that all of us should do something. We should focus on what we can do, both individually and collectively. I mentioned the real example of our national healthcare plan, and I meet professionals very often, and everyone seems to be working in its own silo. We think we are at the center of the world, but we should move ourselves away from the center of the world, and we should consider ourselves as part of a broader network. And in a network, there's no single center. Everything is connected with the rest. So we should be strong enough to create networks, feel part of a network, and at the same time we need to be aware that others and other components need to be work as well, because even though we are in a strong part of this network, the whole network, the entire network needs to work well. Thanks. So we understood that One Health is not only a concept, but it is also made of concrete actions. And as you mentioned, animal health, yesterday, Professor Massimo Recalcati was here. He was talking to students of philosophy on happiness, and he made an example of his little dog. He mentioned the definition by the WHO by the complete overall well-being status. He said that it is like a utopia, but he said when there is a disease, the organs of our body speak, and when they do, we are also worried about our future. So you previously said that after receiving your diagnosis, and I was also diagnosed with a tumor a few years ago. Unfortunately, that wasn't the case, but I had already made my final speech to my sons back then. And Professor Recalcati said, when my dog is sick, he doesn't think about she doesn't think about the future. She's only concerned about the present. So we have another expert in the field of animal health today, Professor Marabelli. He's an advisor to the Director General of the World Organization for Animal Health. So thank you for being with us. Thank you. First of all, I want to thank the Federation of Associations and the Italian Bishops' Conference. I'm very delighted to be here, and I also want to mention what I did in the past as the manager at the Ministry of Health when the Laudato Si encyclical by Pope Francis was published. And I was here to present about that encyclical, and I mentioned this because these insights that we are sharing around One Health also bring me back to what I said when I studied the encyclical encyclical message, and of course, reality overtook over fantasy. The pandemic came in, and the World Health Organizations gathered in 2021 and created this four-party approach, which should act as a reference for the whole world. And this four-part approach also created a scientific committee, a scientific board with 26 members. And in this second mandate, in this second term, we also have an Italian member, and that is extremely positive for our country. I would also like to recall that on the global level, Italy is one of the few countries having in its Ministry of Health a kind of single approach, and this also helps us to tackle the challenges lying before us. Of course, we need to add the environmental challenge to all of this, because it's another essential component of it all, and I will try to clarify how this is both a challenge and a limitation that we should take into consideration. Monsignor Angelilli rightly noticed and rightly highlighted that we need to take concrete actions. And at the World Organization for Animal Health in Paris, we often discuss high-level topics and move from one topic to the other. And we tackle animal health from different aspects, especially those affecting global health. One of the aspects I had the chance to study over the past years that was mentioned several times today is that health is an opportunity for development and it shouldn't act as a brake. It is a chance, it is not a cost. Secondly, the social and economic impact needs to be taken into account as it can help us create our policies, especially when we consider food poverty and the availability of food, because that is the foundation for our societies worldwide. And when we do so, we become aware that when we contribute to a healthy production, which is also environmentally friendly, we also help these populations both socially and economically. So even though the economic aspect may look less important compared to the global approach to health, it can also be an extremely significant driver. So what's the current situation? Well, we need to take two components into account: the production aspect, the availability we have at our disposal, and I believe that healthcare needs to reflect on food security, food safety overall, and that is not a matter of product hygiene, as we've always done in our job, but also the aspect of food security. That is the availability of food for everyone. Of course, there's no food security without food safety, because if food is not safe, it is not available either. However, having food is a challenge. Having sufficient food is an open challenge. And we have a whole series of contradictions that we have to untangle. But we have two worlds in front of us. We have the world we live in. It has a wide resources in terms of food, and there's another world, another part of the world which has no access to those resources. Our world is limited by definition, it has limited resources, and it has an expectancy which could be considered as unlimited. When we discuss with each other, with other countries, we only represent 40 to 50 people, countries. The advanced world has to face the remaining 190 countries in the remaining part of the world. We have 450 million people in Europe versus 8 billion people in the rest of the world. And some parts of the world, in China, in India, are exponentially increasing their presence. So what's our first objective? It is access to food. And access to food very often has to face the request for animal-based food, from both in terms of quality and social status, social value. Animal-derived food is something that all countries aim for. And this, of course, is the real problem, the real issue. Animal production, of course, has a strong impact for the environment.
And this goes against the principle of the United Nations that has decided that a third of the biosphere needs to be available only to the environment itself, and that means that in terms of land and ocean, of 1/3 of the biosphere must remain a natural environment. And we have realized with the pandemic that when we touch the natural environment, independently of how this then came about, there are always issues, there will always be problems, and therefore it would be best to leave it in an adequate situation. The problem, the issue is that productions can only come about in two ways. We either increase the areas on which we undertake extensive farming, removing the Amazon and the Borneo forest, or we create skyscrapers with pigs in them, like in China or other countries. So the ability of the international organizations, the world of healthcare in general, is that of creating a synthesis, a compromise between these two extremes, intensive and extensive, and both need to be avoided. All this is done how? Through the so-called standards. These are the rules defined by the WHO, FAO, and the Organization for Animal Health Care. And we have seen, as far as the WHO, that the standards that were given during the pandemic were voluntary standards, such as face coverings or vaccination, but this has brought to great differences from the point of view of capacity and the results that various countries have had. In terms of production, it's the same thing. There are standards which often are more binding. The European Union, as we know, is one of the places in the world that defines in a very strict manner what productive standards should be. This is a very positive aspect for those living in the European Union, but less so for those who are outside the European Union. The result is that when we were campaigning abroad in favor of Italian productions and we tried to ensure that international norms were abided by, the first to be unhappy of the relationship with a country such as ours, who is obliged to apply European rules, is that of saying, well, yes, you're asking us for the application of international rules, but often you are the first who does not apply these because you are restrictive against us. What's the final result then? That nowadays we are seeing a twofold issue. First is that the so-called countries of the south of the world who want to have better access to food are asking themselves whether the standards we have put in place are correct or simply a form of protectionism. Example, one of the greatest beef production country is India. Few know this. Aside from the Hindus, Indians have entrusted the Muslim part of the country the production of meat, and India is the greatest producer of beef. They do not have international standards because they are at risk of bovine herpes, and yet they export to more than 150 countries. Aside from us, these countries don't always apply international standards, such as Venezuela, Nicaragua, and other countries in Africa who have economic problems, and they don't care about herpes because they need to make their population feed itself. And this is the first problem we are dealing with and which we have to resolve. So we need to work in order to avoid that most countries decide to move away from those international protocols that Mr. Leonardi has told us with his glass half full have improved quality. The other dimension is the financial matter. Today, in Italy, for example, we are living in a country which produces a maximum of 50% of the entire food required by our population. But if we subtract from this the raw materials we import from South America, then we're looking at a lower figure. Why does South America then sell raw materials to Europe? Because we are the best payers, or we have been so far. But do you think that once other countries have a higher paying ability, or those who will go on to South American markets in terms, for example, of cereals, and they would say, look, we are India, we are China, if Europe pays 10, we're going to pay 12. And do you think that they will continue trading with us just because we have migrant origins and therefore they're just going to supply us with this product? I don't think so. This is what we need to work on. We need to work, on the one hand, at creating a network of loyal countries which are interested in applying healthcare norms that will also aid their own population to develop. On the other hand, we need to create a technological development system in our country allowing us to produce better without impacting on those two aspects, or basically navigating between intensity and the safeguard of the environment, the two extremes. We were talking about the Po Valley air pollution problem. I have seen bovine rearing through a complete cycle management of excrement and dung, allowing in a robotic manner the management of gases and the recycling of all dimensions of this production cycle. Therefore, we see ourselves in need to increase the technology applied to these industries. Two further aspects. The first one is that of the impact of the so-called private standards, as well as international standards, which are part of our remit. One of the great challenges is that of keeping control on the part of the public bodies that standards are being applied. The private dimension of private production industry of great distribution and logistics chains are developing their own standards. Should this become a habit, and should all great distributors agree, then we would have that demand-fed imposed standard, giving the world consumers what they think is better through standards that differ from that of our own authority. The final point is that of security. We saw during the war in Ukraine that the food security issue was graver than the energy security one. This is the challenge for the future, because for energy we just change the pipe from Russia. We get our energy from Tunisia or Azerbaijan. But during the war, the ships with grain or other foodstuffs had to be unblocked, otherwise we would have been blocked. Finally, I come to the bird flu, which is blocking the United States from progressing. The current administration, who are trying to claim Greenland from Denmark, have had to freeze this request, because as eggs in the United States are now $10 a box, when the president had promised all Americans that they could have breakfast with $1, The administration today is much more interested in purchasing eggs from Denmark and from our Veneto region than the Greenland fracas. I mention this because these aspects linked to health are important and crucial, and they are something where we can hope to have an impact. Thank you. I understand that unless men can convince the powerful, animal will, because eggs are important social determinants. Thank you. Thank you very much, everyone. And now we come to a crucial moment. I ask Isabella to assist us because the delegates of the federations and councils have worked from the beginning to now to the drafting of a value charter. I think we mostly agree on values. And I was a politician for a few years, and we always talked about the common good. We all talk about the common good. Raise your hand if you don't agree on the common good, then we need to understand how this is interpreted. So we all agree on values, except if there are enormous divergences. The issue is a practical one where values differ. We thank those who have done the work for us, and if you don't like a word or two, I'm sure we can compromise on that, but what counts is the content. I would also like to thank those in charge of the press office. They undertake a hidden task, but one which deserves our thanks. Don Massimo, did you wish to say something before reading it? Just the fact that this text was developed by the representative of all national federations. It was coordinated by Madam Angela Basile, who has worked to collect the feelings of all the federations. This is a basic text because at the end it seems obvious, aside from the technical part, we need a clear context of values where we need to start again and where we need to begin. So thanks to the working group who has coordinated this text. And in the communique agreed upon between the Federation and the Council, I would like to highlight this expression. The objective is to give value to the care relation between professionals and those cared for. And we are going to read the text. This is the value framework identified through some key expressions which should be the weft and the warp of the world of health. The incarnation of these key words is the result of a choral effort. We have put together meaning proposals and sensitivities of the various federations and the professional of health's effort. It is an effort. The first key word is person. The concept of person offers a deep understanding of the unique character and the social dimension of every human being. This is a unified totality which is presented through essential properties of corporeity and spirituality, and which is permanent and substantial. It has intelligence, will, and freedom. The human living being decides of themselves and others in a relation with reality. Every person is a key of meaning of the human value, not just an existing person, but a subject of their existence, able to take it on and address it. In the relation of care, social professionals recognize its central role and respect its dignity by humanizing this relation. Dignity. Before the dignitas curae, there is dignitas personae. Dignitas is substantial to the human being. It is a co-nature and designates a subjective consideration of self and its value and honor. It is a condition of nobility in which every person is placed by their human nature, and the respect for this condition is due to them, and it is due to him or herself. Social healthcare workers in their intention and goal shall have to tend towards this through an aware, competent and responsible action, always bearing in mind the dimension of therapeutic alliance, respecting the conception of life of persons to whom their care tends. The dignity of every person is respected also as the planned shared interventions and cares are put on the table. Care maps our inner attitude. It is understood as solicitude, care and occupation. It means caring for people and the ecosystem, and it means stewarding and making grow. This represents the first and last goal of all healthcare professionals and determines their knowledge and engagements, their actions, which is both speculative and concrete. Health. This is a dynamic state of physical, mental, spiritual, social, and environmental well-being, and not simply the absence of illness. A healthcare professional serves those persons they work with, and they finalize their intervention in order to safeguard their rights in the interest of the entire community. They promote and develop the increase of safety of care as an element to guarantee health in cooperation amongst all healthcare professionals and with civil society. They identify contexts in which we can carry out activities of promotion, prevention, and education to healthcare. Relationship of care takes place when our gaze is looking towards every person and their need through the use of active listening and dialogue. This relationship is distinguished by humanity and empathy, respect and kindness. The latter is able to create through its ethos authentic and loyal relationships. In appropriate communication, healthcare professionals commit to generate this link with persons, assessing their body language, understood as spaces and distances adequate to every situation. A healthcare professional in a relationship of care respect and promote the decisional independence of every person, exercise a freedom of conscience, and guarantees a continuity of care. For healthcare professionals, the time of relationship is a therapeutic time. Skill. Every skill for a healthcare professional integrates knowledge, technoscientific knowledge, and relational ability, as well as appropriate behavioral posture, conferring onto them the authority to treat, discern, judge, and resolve certain issues. A healthcare professional is formed and self-educates in a continuous way so as to be able to supply a service which is always more qualified. They conform with discernment to the development of research and scientific evidence, as well as ethical and deontological aspects, which are both jurisprudential and managerial. They always act with a spirit of responsibility and commitment, and even in the use of innovative digital tools, but aiming towards a relation of care in presence, applying ethical norms and guaranteeing security and continuity in care. Responsibility represents taking charge of persons and engaging to constantly respond in intentions and concrete action through a virtuous, honest, and free behavior, inspired and tending towards the good of the person, the environment, and everything surrounding it with a spirit of solidarity. Every professional bases their responsibility on eludable skills guaranteeing health and safety, responding and preempting the needs of healthcare of every person, of the social community and the environment. In this, we see a sense of cooperation and collaboration, respect for reciprocal skills and the autonomy of every profession. The healthcare professional respects and participates to actions to prevent the appropriate use of resources for an eco-sustainable development. Freedom is considered to be an essential component of the definition of every man's and woman's being. It confers meaning to existence, and it distinguishes and specifies the action of every man. It is the ability to self-determine, but it requires at the same time specific attention to the physical and socio-cultural conditioning factors which deeply mark being and acting. Healthcare professionals place as a watermark the exercise of freedom linked within the relationship between a conscience and a trust towards the persons they assist, always seeking good and always safeguarding without any form of conditioning the dignity and the freedom of their own and other persons. Multi-professionalism and interprofessionalism. The healthcare professional engages to create with colleagues of all professions a relationship of trust and respect by recognizing equal dignity, specificity in the various skills and aimed at the common good, to good and the promotion and safeguard of healthcare, of the collectivity and the ecosystem, contributing towards relationships which are of cooperation and solidarity. Equity. Equity represents a concrete action of the principle of distributive justice, which is translated into criteria of proportionality measured to the different conditions of individual persons who entrust to this system and the entire community. It means equal opportunities in accessing care and healthcare services through the correct use of resources and a programming which is well thought out and assessing the actual need for health. The professional needs to bear in mind ethical, social, as well as economic factors in a virtuous and responsible manner, both for public resources and for private resources, by always safeguarding the dignity of every person and their healthcare needs. Conclusions. These reflections are elaborated as a group, and they are only a starting point for a manner of thinking and operating in the world of care and taking care. It is a commitment to rethink and never to lose sight of our horizon, which is made up of fundamental issues and which have brought each one of us towards this profession. We are certain that not only in the intentions but also in concrete action, the values which we can see against the light in this simple list can orient us so that they may bear good fruit for persons, for collectivity, for the environment and the entire ecosystem, simply by feeding as much as possible hope. The presidents of the federations and the national councils of professional healthcare, social healthcare and social assistance healthcare recognize themselves in this text and underwrite it. Thank you.
As we thank everyone who worked on this, this is a way to somehow conclude our path of sharing, of collaboration, cooperation, a journey that involved us all as a supporting party, as the Italian Church, as the Italian Bishops' Conference, and National Office for Pastoral Care for Health. And I'm happy to have collaborated with the 11 federations who contributed to this, because they welcomed my invitation, they accepted my invitation, and we opened a new space for collaboration. In my conclusion, I would only like to add that as we wrote the conclusion of this text that you will receive by email tonight, there's a sentence saying that this is just a starting point for our future thinking and operating actions and way of operating. And these words have a deep value as they translate into concrete behaviors, because there are many value charters, but if they do not translate into actions, they stick to words. Our objective for this journey was to create a common basis, and at the end of this journey, I also share this text with the presidents of the foundations, so that this becomes an operational practice for you all, because each and every one of you can contribute to this journey to create a different way of thinking and of operating. So the best part begins now, so that after listening we can now take action. Of course, you will have our support to do something good. So thank you all. However, if it's true that we are closing this journey, the door is still open. Well, if we hurry up, it is. So some practical information for you by Don Massimo. So we say goodbye to those who will not be able to come with us at the Holy Door. Please remember to give back the receivers and take back your ID. As we leave this room, and after giving the headphones back, we will meet at the entrance in 10 minutes. In 12 minutes, we will walk a short distance to get to the Basilica, and we will pray down here, and then we move directly to cross the Holy Door. Thank you all once again.